Imagine, you, it, your dad is getting older and he's starting to face some health challenges, maybe even something like Parkinson's disease.
Right.
And then you start hearing about this treatment called deep brain stimulation, like DBS. You hear that term being thrown around,
Yeah.
but you don't really know what it involves.
Uh-huh.
So that's where this deep dive comes in.
Absolutely.
We're going to be using information from Medline Plus to break down what DBS is all about.
Great source.
Yeah, they're known for having really reliable medical information.
Yeah, very trustworthy.
So let's start with the basics. When I hear deep brain stimulation, I kind of think of something out of a sci-fi movie.
Right.
What is the simplest way to understand what this actually is?
Well, I think the best analogy is to think of it like a pacemaker for your brain.
Okay.
So just like a heart pacemaker helps regulate your heartbeat, a DBS system uses these implanted electrodes and something called a neurostimulator to send electrical signals to very specific areas in the brain.
So it's like it's giving the brain a little tune-up. Can you explain what a neurostimulator is and how it works?
Yeah, so it's a small device like a battery pack, and it's usually implanted under the skin around the collarbone area.
Okay.
And it sends these continuous electrical pulses to those electrodes in the brain, which then helps control things like movement, mood, and other functions.
So instead of open brain surgery, they implant this device and it sends signals to specific areas.
Right, and that's why it's called deep brain stimulation.
Okay.
Because it's reaching those deep brain structures without actually having to do traditional open surgery.
So interesting.
Yeah, and the other cool thing is that DBS is not just for Parkinson's anymore.
Really?
Researchers are discovering that it can be used for so many other conditions.
Wow.
But let's get back to the mechanics of the DBS system.
Okay.
The source mentions 4 main components.
Yeah, the Medline Plus resource mentions the implanted nature of this treatment, which I think is fascinating.
Yeah, it's pretty remarkable.
Yeah.
So let's break down those 4 parts. We've got the electrodes or LEDs, which are these thin wires that are placed in specific areas of the brain.
Okay.
So think of them like the messengers delivering those electrical signals.
Okay.
Then there are anchors that are used to make sure those leads are nice and secure against the skull.
Makes sense. You wouldn't want those moving around.
Yeah, definitely not.
And what are the other 2 components?
So we've already talked about the neurostimulator, which provides the power.
Okay.
And then the 4th component is an extension, which is basically a wire that connects the neurostimulator to the leads.
Okay.
So you can picture it like an electrical pathway under the skin, transmitting those signals from the power source to the brain.
So they implant this entire system. What does that process look like?
Well, it's actually a 2-stage surgery.
2 stages?
Yeah, which is designed to make it as comfortable as possible for the patient.
That sounds a little daunting, 2 stages of surgery.
It's not as bad as it sounds. The first stage involves placing those electrodes, and what's really interesting is that the patient is actually awake during this part.
Wait, awake for brain surgery.
Yeah, they use local anesthesia, so there's no pain.
Okay.
And they use these advanced imaging techniques to make sure those electrodes are placed in exactly the right spot.
Wow.
And they can actually test the electrodes by having the patient answer questions or move their limbs during the surgery
Oh, wow.
to confirm they're working properly.
So they can make adjustments in real time
Exactly.
based on the patient's responses.
Yeah, it's about finding that sweet spot for those electrodes to really maximize the therapy's benefits.
Wow.
So the second stage is where they implant the neurostimulator, and this is under general anesthesia.
Okay.
And it's typically placed near the collarbone, and they connect everything up, and then it's all tucked away neatly under the skin.
It's like a tiny little high-tech control center
It's
under the skin.
yeah, it is.
Pretty remarkable stuff.
It is pretty amazing technology.
But you mentioned earlier that DBS isn't just for Parkinson's anymore.
Right.
What are some of the other conditions that it's being used for?
Well, it's really becoming a very versatile tool.
Okay.
The source mentions conditions like major depression, obsessive compulsive disorder,
Well,
chronic pain, and even obesity.
obesity. Wow.
And they're also investigating its use for essential tremor Tourette syndrome, dystonia, and epilepsy.
That's a really diverse range of conditions.
Yeah, it is.
What does that tell us about how DBS might be working on like a basic level?
Well, it seems that the brain's electrical circuits play a much bigger role than we initially thought. And we're discovering new connections all the time.
Okay.
So, for example, take chronic pain. Imagine being able to target those specific brain areas that are involved in processing pain signals
Okay.
and being able to offer relief that traditional pain medications just might not be able to achieve.
That's an incredible possibility for people dealing with chronic pain.
It is.
Are there any other promising areas of research that you find particularly fascinating?
I think one of the areas that is generating a lot of buzz is the use of DBS for obesity.
Really?
Yeah, it's still early days, but the idea is to see if we can use DBS to target those areas of the brain that control things like appetite and metabolism.
So it's not just about zapping away cravings.
Right.
It's more about influencing the brain's control center for eating habits.
Exactly. And it highlights how intricate the brain is and how much we're still learning about its influence on our overall health.
It's almost like we're starting to understand the brain's language, its electrical language.
That's a great way to put it, yeah.
Yeah.
We're uncovering these new pathways and connections all the time. It's very exciting research. But with any procedure, especially one as complex as DBS, there are bound to be risks, right?
It seems like it would be a pretty big decision to make.
It is, right? DBS, like any surgical procedure, does have potential risks, and it's not a decision to be taken lightly.
Right.
The source mentions things like infection bleeding issues with the hardware and also the possibility that you might need additional surgery down the road.
If someone is considering DBS, what are some of the most important factors to consider?
I think the most crucial thing is a thorough evaluation by a team of specialists.
Okay.
They're going to determine if DBS is a good fit based on your specific needs and your overall health.
Okay.
They'll explain all of the potential benefits and risks.
Mm-hmm.
And, for older adults, it's especially important to discuss any additional concerns that they might have.
That makes sense. Age can be a factor in any medical decision.
Absolutely.
What would you say to someone who's asking, is DBS right for me or my loved one?
I would say gather as much information as you can.
Okay.
Ask your doctor lots of questions and really weigh the potential benefits against those risks.
Okay.
It's also really important to understand that DBS isn't a cure.
So it's more about managing the symptoms.
Exactly. The source emphasizes that DBS can lead to significant symptom improvement
Okay.
and a better quality of life for many patients, but a lot of people will still need medication, often at lower doses, though.
Okay, that's still a really positive outcome. Less medication, I feel like, is always a good thing.
Absolutely, especially for older adults.
Yeah. Are there any other aspects of life with the DBS system that people should be aware of?
One thing that often comes up is airport security.
Oh, yeah.
Yeah, you will set off those metal detectors.
Okay.
But don't worry, airport security personnel are very familiar with DBS systems.
Okay.
You'll have an ID card to show them, and they usually just use a handheld scanner to clear you.
So it's a minor inconvenience, but not a travel deal breaker.
Exactly.
What about maintenance? Does the system ever need adjustments or replacements?
Well, the neurostimulator's battery does need to be replaced eventually, just like changing the battery in a pacemaker.
Uh-huh.
How long it lasts depends on the type of system and the settings, but it's usually every few years.
Okay, so that's another procedure to plan for.
It is, but it's typically much simpler than that initial implant surgery.
Okay, good to know. Now, you mentioned earlier that researchers are exploring DBS for all sorts of conditions beyond Parkinson's.
Yeah.
What are some of the most cutting-edge applications that they're looking into?
Well, there's some really fascinating research happening on the use of DBS for psychiatric disorders,
Uh-huh.
like major depression and obsessive-compulsive disorder.
Oh.
These are conditions that can be very challenging to treat with traditional therapies. So DBS could offer a whole new avenue of hope.
It sounds like we're on the verge of a whole new era of treatment options.
It really does feel that way. We're rewriting the possibilities for treatment, and that's incredibly exciting. But this kind of progress also comes with ethical considerations, and that's something we need to be very mindful of as this technology continues to evolve.
It's like we're stepping into a new frontier of brain science, and we have a responsibility to make sure we navigate it carefully and ethically.
Absolutely.
What are some of the key questions that we should be asking as a society?
Well, one of the big ones is, what are the limits?
Okay.
How do we ensure that DBS is used responsibly for therapeutic purposes and not for things like trying to artificially enhance abilities or create unfair advantages?
All right, like that's getting into some tricky territory.
It is. These are big questions that we need to be having very open and honest conversations about as we move forward.
These are definitely complex issues, and it sounds like we're only at the beginning of the conversation.
Absolutely. But it's a conversation worth having, and speaking of conversations, we've covered a lot of ground in this deep dive.
We really have. What would you say are the most important takeaways for our listeners, especially for those who might be considering DBS for themselves or a loved one?
Okay, well, firstly, I think DBS can be a game changer for people who are struggling with certain conditions.
Okay.
It's not a magic bullet, but it can offer real relief from symptoms and significantly improve their quality of life.
Right.
Secondly, it's important to go into it with your eyes wide open, do your research, talk to your doctors, understand those potential benefits and the risks.
Okay.
And finally, remember that this field is constantly evolving. New research is emerging all the time, so stay curious and stay informed.
Those are great points. And speaking of staying informed, the Medline Plus resource that we've been using is a fantastic place to start. We'll be sure to include a link in the show notes.
Wonderful. It's a great resource.
It's a fantastic source of reliable information.
It is.
So I'm curious, as an expert in this field, what is the most surprising thing you've learned about DBS in your research?
You know what continually amazes me is how much this technology is revealing about the interconnectedness of the brain.
Uh-huh.
We used to think of certain brain areas as being responsible for very specific functions.
Right.
But DBS is showing us that it's much more complex than that.
So it's like those old brain maps we used to see in textbooks. They're becoming obsolete.
In a way, yes. With DBS, we're seeing how stimulating one area can have these ripple effects throughout the brain,
Wow.
influencing a whole range of functions. It's truly remarkable.
It is incredible to think that we can target these very specific brain regions now with these tiny little electrodes. I imagine the precision required for that is just mind-boggling. It's almost like a GPS system for the brain.
That's a great analogy.
Yeah.
And it does require a very high level of expertise. Neurosurgeons use sophisticated imaging techniques and real-time feedback from the patient during surgery to guide those electrodes to precisely the right location.
You mentioned earlier that the neurostimulator needs a battery replacement every few years.
Right.
What's that procedure like?
Well, it's typically a much less invasive procedure compared to the initial implant.
Oh.
You just make a small incision near the neurostimulator, swap out the battery, and you're good to go.
Okay, so it's not a major surgery each time.
No, not at all.
That's reassuring. Now, before we wrap up, I want to circle back to something you said earlier about the ethical considerations of DBS. You mentioned the potential for misuse or enhancement beyond therapeutic purposes.
Right.
It reminds me of those sci-fi movies where people get brain implants to boost their intelligence or their physical abilities.
Yeah.
Is that something we should actually be concerned about?
It's definitely a conversation that we need to be having as a society right now.
Yeah.
DBS is focused on treating medical conditions,
Right.
but as the technology advances, the potential for enhancement will likely become more of a reality.
Okay.
And that raises some big questions about fairness access and what it means to be human.
It's almost like opening a Pandora's box of possibilities, both positive and potentially negative.
That's a good way to put it. It's exciting to see the therapeutic potential of DBS, but we also need to proceed with caution and thoughtful consideration of the broader implications.
So as we wrap up this deep dive into the world of deep brain stimulation, what's the key message you want our listeners to walk away with?
I'd say this DBS represents a remarkable leap forward in our ability to treat neurological and psychological conditions. It's a powerful tool, and as with any powerful tool, we need to use it wisely and responsibly.
That's a great point. And to our listeners, if you want to learn more, we encourage you to explore the full Medline Plus resource, which we'll link in the show notes. It's a fantastic source of reliable information.
It really is. And remember, the more informed you are, the better equipped you'll be to make decisions about your health and the health of your loved ones.
Thanks for joining us on this fascinating journey into the world of deep brain stimulation. Until next time, stay curious.